Let's discuss an interesting case here. We call it hypoplastic left heart syndrome. Hypoplastic left heart syndrome. What this means is that the left portion of the heart is not well developed. And I'll discuss a case, a fetal case, where I was doing a scan at 24 weeks. That's a normal scan. And on doing a scan, I realized that the left portion of the heart of the baby was not well developed. We realized that the left ventricle was narrowed, the left atrium was narrowed, the left mitral valve, the valve that separates the left ventricle and the left atrium was narrowed. We also realized that the aortic valve was narrowed and the arch of the aorta was narrowed. When you're doing fetal echo Doppler, we realized that there was a reverse flow in the arch of the aorta. Actually, all these point towards one problem, and that is the left hypoplastic heart syndrome. So sonographers outside there, even as we do scans, let us be keen on the fetal heart, especially when you're doing fetal echo during the anomaly scanning. Let us be very careful when we are doing this. Unfortunately, this case was discussed with the parents, but the parents decided to have the baby, and unfortunately, we lost the baby at 7 weeks after birth. Of course, after so many things, the baby going into being hospitalized, being admitted in the ICU, but we lost the baby before any medical intervention was done. So when we are doing the scanning, let us be keen. Especially when you're doing the fetal echo, let's make sure you look at the 4 chambers, make sure that they are there. I've done scans for so many years, and I know sonographers will just want to look at the fetal movement, just want to look at the fetal heart, and the examination stops there. But even as you do this examination, especially normal scanning, make sure you do the 4 chambers. We see the 4 chambers. Look at the valves, look at the mitral valve, the tricuspid valve, the aortic valve. Make sure you look at the outflow tract, look at the ascending aorta, look at the arch of the aorta, the branches of the arch of the aorta. Look at the pulmonary artery. Make sure you see the branches of the pulmonary artery. It's in branches in the left branch and the right branch. I think that is something that we need to be very keen when you're doing a anomaly scan, especially at this period. We don't share this information to spread fear. It's just to make sure to enlighten our professions, enlighten people outside there, that let us be keen when we are doing this thing. Because once we pick some of these conditions, we'll be able to help the baby or to help the parents even as they plan on the delivery. So thank you and have a great day ahead.